Good evening and regards. My name is Dr. Anand, and today we're going to talk about a wonderful topic. The topic of choice is breastfeeding, and this session will be spoken in English language. So, today's topic of choice we're going to talk about is breastfeeding, and we'll start off with the important one liners, important topics regarding the breastfeeding. So, before starting any segment, we always have a quote. And what is the quote for today? The quote for today, very important, is the quote is if you don't sacrifice for what you want, if you don't sacrifice for what you want becomes a sacrifice. If you don't sacrifice for what you want becomes the sacrifice. So basically hard work plays a very important role. You must have a good hard work and good consistency in anything which you do in life. If you don't sacrifice for what you want becomes the sacrifice. Now, what is the definition of breastfeeding? A very simple topic. How do you define breastfeeding? So, breastfeeding, like there's a simple this thing. It is no food or drink unless medically indicated medicine. Basically, there is no food or drink unless medically indicated medicine. Breastfeeding started within 1 hour of life till 6 months. That is known as exclusive breastfeeding. I'll repeat again, no food or drink unless medically indicated medicine. Breastfeeding started within 1 hour of life till 6 months. That is known as exclusive breastfeeding. Now we all know, like exclusive 6 months, only and only mothers feed, nothing else. But the question over comes here that there are a lot of questions. First question is breastfeeding should be given like exclusively. I understood for 6 months, but after 6 months, for how long should I continue breastfeeding? So basically, 6 months exclusive breastfeeding, and after that, you will continue breastfeeding. And breastfeeding it is continued till 2 years of life. Breastfeeding is continued till 2 years of life. Means beginning 6 months, so you will give only and only mother's feeding. But after that, you will continue mother's feeding. But along with the mother's feeding, you will do complementary feeding. Complementary feeding. Sometimes the mother thinks that after 6 months of life my feed is not required, and that's it, finish. I'll My feed is not required at all. But you must breastfeed the child. Like after 6 months you will continue breastfeeding, and with the breastfeeding you will give the complementary feeding. And complementary feeding can be given in the form of dalia, smashed potato, porridge, khichdi. These are the questions, the viva question they ask, that what all complementary dishes can be given to a child. So it is dalia, smashed potato, porridge, or khichdi. The next question we have over here is that when do you celebrate breastfeeding day? Days are very important. When do you celebrate breastfeeding day? So one thing you must appreciate, that there is nothing known as breastfeeding day. There is something known as breastfeeding week. So we don't celebrate breastfeeding day. We celebrate breastfeeding week, and that comes in the first week of August. A very basic questions, viva question, exam question. Doctor, my baby is not feeding well. If you are the resident on duty, midnight 2 o'clock, a mother comes to you that doctor, आज ही delivery हुआ है, बच्चा दूध नहीं पी रहा. Doctor, today only delivery has happened and my baby is not feeding well. If the baby is not feeding well, what will you do? Okay, if the baby is not feeding well, what will you do? So number one, very simple ones. If you are the doctor on duty, you will get a question, doctor, my baby is not feeding well. You will tell the mother, show me how are you breastfeeding the child. Show me how are you feeding the baby. Why do you want to see how am I feeding the baby? Because I would like to see the signs of good attachment. Exam question. What are the various signs of good attachment? Yes. So mouth wide open, like this is a UPSC question. It came in UPSC, FMG, NEET PG. These are like, which of the following is not a sign of good attachment? Which of the following is a sign? So it is mouth wide open with fullness of cheeks. Baby's lower lip is everted out. Mother's upper areola is exposed out. and chin touching the breast. Chin touching the breast, mouth wide open with fullness of cheeks, baby's lower lip is everted out, and mother's upper areola is exposed out. What they ask in exam that a baby's upper lip should be everted out or lower lip. So the answer is baby's lower lip should be everted out. Okay. Yeah, there is something known as signs of good attachment, and there's something known as signs of good positioning. So baby of like the body of the baby should be well supported. Baby should be turned towards the mother. Like now, this is not an exam question, but this in general you should know. Body of the baby should be well supported. Baby should be turned towards the mother. Occiput, shoulder, and buttocks of the baby should be in the straight line. Abdomen of the baby should touch the abdomen of the mother. AA. Abdomen of the baby should touch the abdomen of the mother. Now, these are the exam questions. In a case of normal vaginal delivery, you should breastfeed the baby as soon as possible. And in a case of cesarean section, you should breastfeed the baby within 4 hours. So, these are the questions. For cesarean section, within 4 hours, you have to feed the baby. In a case of normal vaginal delivery, as soon as possible. So, what are the various reflexes help in the breastfeeding? What are the various reflexes help in the breastfeeding? So, yeah, so this is important. One is, if so, sir, are you asking about reflexes in the mother or reflexes in the baby? If you're talking about reflexes in the baby, that is known as rooting and sucking reflex. Rooting and sucking reflex is a reflex present in the baby, and the reflex present in the mother, it is milk secretion reflex and milk ejection reflex. So as you can see this picture, milk secretion reflex, and which hormone is responsible for milk secretion reflex? Prolactin. Prolactin is responsible for milk secretion reflex. Remember the mnemonic PP and OO. PP and OO. Prolactin produces the milk. Prolactin produces the milk, whereas oxytocin oozes out the milk. Oxytocin oozes out the milk. So basically, oxytocin is present in the smooth muscles of the nipple, and oxytocin stimulates the muscles surrounding the breast to squeeze out the milk. So milk secretion and milk ejection are the two reflexes. Next question. Okay, this is very easy. Yeah, this is a very important exam question. So yeah, okay, 1 second. This is a very important for exam. So this is like, if you have to, if the mother says I have to go for a marriage and I can't breastfeed the baby in public, so how can I breastfeed my baby? So you can express breast milk. You can express breast milk. You can squeeze out the milk in a container, in a glass container, and breastfeed the baby. The questions are, if you store the breast milk in room temperature, mother's milk, if you store it in room temperature, for how many hours you can store? The answer is you can store for 6 to 8 hours. You can store for 6 to 8 hours. And if you have to, if you keep the milk in the fridge, then you have to keep it for 24 hours. So breast milk in room temperature, you can keep it for 8 hours. In the fridge, you can keep it for 24 hours. That is 1 day. And if you keep in minus 20 degrees Celsius, you can keep it for 3 months. You can keep it for 3 months. And what is the maximum breast milk output? That is at 5 to 6 months of pregnancy, of post of having a baby, a mother produces 730 ml of milk per day. A mother produces 730 ml of milk per day.